Now, as the world prepares for future health pandemics, a recent study by Aga Khan University has revealed the urgent need for measures to protect female health workers during health emergencies. The study, titled Women in Health and Their Economic Equity and Livelihood Status During Emergency Preparedness and Response, WELA, revealed that while health systems heavily relied on women for healthcare provision, they failed to address gender-specific burdens the workers faced.
What we found out from the study is that the healthcare workforce suffered in terms of their mental health, their well-being, as well as their livelihood, but also the issues of gender, where we saw more of the women who had extreme effects of COVID-19 and its mitigation measures, as opposed to those who are men, and more so those who are within the unpaid cadre, who within the healthcare system are the community health promoters. So for us today was really to share the findings and also to come up with recommendations through the use of participatory approaches.
Over 70% of all of the frontline healthcare providers are women. And while we rely heavily on them to deliver the services that we need, whether it's at the community or a facility, we're very unresponsive to their own needs. So we tend to think of women as, a homogenous group. We don't recognize that if you're a woman who's single or married or has children or doesn't have children, or who's in a paid position or an unpaid position, that your lived experience, both within your workforce and in your community, can be very different. And that really came out in the findings from our study, that women, whether they were paid or unpaid, were more affected economically from a mental health perspective.